Joe was a 46-year-old guy, not his real name, who had a BMI of 31, which is categorized as being obese, but he was otherwise healthy. Then he starts getting some diarrhea, and he didn't really think much of it. He also had a little bit of belly discomfort, feeling gassy and such. 2 weeks later, he ends up in the ICU, which was when I first met him, while he had a breathing tube down his throat. But how does he go from being a healthy guy, having some diarrhea, to being in the ICU and on a ventilator? Well, someone thought it would be a good idea to treat his diarrhea with an antibiotic, which usually never works. As it turns out, the antibiotic did not help his diarrhea, and in fact caused him to have a severe allergic reaction called anaphylaxis, to the point of his throat closing up, severely impacting his ability to breathe. After his wife called 911, paramedics showed up, inject him with some epinephrine, and end up putting a breathing tube down his throat in order to save his life. So the ambulance takes him to the ER, and once he makes his way to the ICU, we treat him with more steroid medication to get the swelling down in his throat. A day later, we're able to successfully take out the breathing tube. As a critical care physician, at that point, my job was done. We transfer him out of the ICU, but his diarrhea was still there. He eventually gets a colonoscopy, and when they go looking up his rectum and into his colon, there it is, a tumor sitting there in the left side of the colon. Luckily for him, they caught it early, and his doctors were able to cure him of his cancer. Colon cancer, also known as colorectal cancer, often begins as small, non-cancerous, meaning benign, clumps of cells called polyps that form on the inside of the colon. Over time, some polyps end up transforming into cancer. Symptoms of colon cancer can vary and may not always be present in the early stages, but if they do occur, these are the 6 warning signs that you should never ignore. Number 1 is a change in bowel habits, such as diarrhea, constipation, or a change in the consistency of the stool, especially if this is going on for more than a few weeks. Okay, number 2, no pun intended, is if you see blood in your stool. Sometimes blood in the stool appears as bright red, but sometimes it appears as maroon or even black in color, depending on different circumstances. Also, if you get some blood work and it turns out that you're anemic, especially if you're over the age of 40, that also becomes concerning for the possibility of colon cancer. Number 3 is persistent abdominal discomfort, such as feeling gassy or having cramps or even abdominal pain. Number 4 is the sensation that your bowel doesn't completely empty when you're trying to go. Number 5 is persistent weakness or fatigue, although there's many different reasons why someone can have fatigue. And finally, number 6, unexplained weight loss. So it's one thing if you're trying to lose weight or if you're taking a weight loss drug like Wegovy or Mounjaro, and that causes you to lose weight. But it's another thing when you don't have a good explanation for the weight loss. There's many medical conditions that can cause weight loss, but certainly colon cancer is on the list of considerations. The sooner that colon cancer can be identified and treated, the higher the likelihood of being cured. So regular screening for colon cancer, especially for those who are over the age of 45 or for those who have a family history of the disease, can help detect the cancer at an early stage when it's more treatable. And if you want to reduce the risk of colon cancer, just remember that colon cancer is one of the 13 obesity-related cancers. The more insulin resistance you have, the higher the likelihood of developing an obesity-related cancer, especially colon cancer. In fact, when you look at the most common causes of misdiagnoses, colon cancer is actually number 1 on the list. The reason these new GLP-1 agonist drugs improve type 2 diabetes and obesity is because they improve insulin resistance. That's why these drugs have such dramatic improvements in so many people's lives, whether that be Ozempic or Wegovy or Mounjaro. It's not just about type 2 diabetes or obesity. It's about getting at the root cause of the problem, which is insulin resistance, especially when you're able to do other things that improve insulin resistance, like healthy food, eating healthy food, meaning unprocessed food, and also doing regular exercise. In fact, eating processed meats is one of the other factors that's highly associated with colon cancer. And of course, not smoking and limiting alcohol intake is very important too if you want to reduce your risk. And then there's other chemicals that are linked with colon cancer, which you can learn more about in this video right here.